Okay, so we'll go ahead and pick back up where we left off on lung cancer. So we were talking about the two general types. There are small cell and non-small cell lung cancers. Let's go ahead and just compare and contrast these. I'll go ahead and start off with the non-small cell lung cancer. This is the most common type. Somewhere around 80% of all types of lung cancer will be classified as non-small cell. Within that general category, we have some subcategories. We have adenocarcinomas, we have squamous cell, and large cell carcinoma, the three types. The second broad category of lung cancer is small cell carcinoma. That accounts for approximately 20% of all lung cancers. Within the small cell category, we have three general types, or more specific types, but they're all considered small cell, and that is the oat cell, the intermediate, and then the combined. It's basically a combination of intermediate and oat cell carcinoma. So those are the two major types, small and non-small cell. The small cell carcinomas are generally associated with a much poorer prognosis. Small cell carcinoma is a kind of cancer you do not want to have. It's very aggressive. Metastasis or spreading of it occurs very rapidly. Generally, the prognosis is going to be very poor with small cell carcinoma. Overall, however, overall prognosis for any type of lung cancer is generally pretty poor. You're only looking at about a 13% 5-year survival rate. So that means that 13% of patients, give or take, of course, and obviously the data that I'm using is a little older, and there certainly has been some improvements in our treatment of cancers. This may have gone up a little bit, but still, about 13% of patients that develop lung cancer go on to survive 5 years, what we call a 5-year survival rate, and that's a common time that we use when we talk about people surviving cancers. When they say, well, he has a 50% chance of surviving, often what they're talking about is the 5-year survival rate. Are you still alive 5 years after you've been treated, hopefully successfully, the cancer? Okay, so let's just go ahead and talk about how lung cancer happens. We talked about how cancer happens in general. Generally, lung cancer, what we currently understand is that it's a result of repeated trauma. And that trauma is generally going to be in the form of inhaling irritants or carcinogenic, and carcinogenic is a big word that means cancer-causing substances. Tobacco, top of the list. Air pollution, really high up there. In areas when I was in Afghanistan, for example, I spent some time in Kabul. Horrific air pollution in Kabul, and no surprise that cancer was pretty prevalent there. Other things like asbestos exposure, heavy metal exposure, people that work in factories exposed to things like nickel, arsenic, and some of the older houses that don't ventilate very well, a certain type of, through radioactive decay that just normally occurs in the ground, in the earth. One of the byproducts of that decay is a gas called radon gas, and in certain houses, in certain areas of the country, that radon gas can get into the house, and people don't even know that they're being exposed to this radon, and it's just from natural decay of uranium, natural U-238 in the soil. And so you may hear about radon detectors and getting your house detected for radon and so forth, so on and so forth. Almost all the cancers start in the epithelium of the lung, the epithelial tissue, and then they kind of spread throughout there. Let's just go ahead and talk about the specific common cancers. And the first one is the adrenal carcinoma. It has a moderate rate of growth. Generally, it will metastasize fairly early. However, it'll go into lymph nodes in the hilum. And we should know the hilum at this point from cardiovascular anatomy and physiology. The hilum is basically the membrane around the lungs where you have the mediastinal cavity. So you'll have fairly early metastasis, so go into those lymph nodes and then work its way into the mediastinum and throughout the rest of the body. This can result in airway obstruction, coughing, and lots of sputum produced. How do we diagnose it? Excuse me, I'm sorry. One of the major signs and symptoms of adenocarcinoma is a pleural effusion, actually. How do we diagnose it? Well, we'll do a bronchoscopy. A lot of these cancers will be diagnosed through what's known as a bronchoscopy. You guys will get a chance to do this in clinicals. You take something called a bronchoscope, which is a flexible scope, goes down through the trachea into the right or left mainstem bronchi, depending on what you're looking at. And you'll generally take a little piece of lung tissue called a biopsy. You'll pull that tissue out. That tissue will go to the lab, and the pathologist will look at the tissue and look for the characteristic findings of the certain types of cancer. You may have to look at it through an electron microscope. Okay, so that's adenocarcinoma. You also have something called squamous cell carcinoma, lung cancer. This generally is a very slow growing tumor. Very late metastasis, takes a while, and mainly goes into the hilar lymph nodes, chest wall, mediastinum, like the other cancers. Because this one can grow slower, there's enough time for obstructions to develop. And this is where we get airway obstructions, because I have slow growing, and there's a growth in there, and it grows slow enough to where it doesn't metastasize and kill me right away like these other cancers. And I get airway obstructions, lots of sputum produced. How do we identify or diagnose this? Sputum analysis. We'll do a biopsy. You can do some immunochemical tests as well. All right, and then large cell cancer, generally very fast. Early extensive metastasis occurs. Generally, it'll go into other thoracic structures. These patients will present, have cough, or they'll have coughing. They'll have hemoptysis, which is coughing up blood, chest wall pain, or sometimes they'll call that pleuritic pain. Pleural effusion, lots of sputum, can develop pneumonias and airway obstructions. How do we diagnose it? Bronchoscopy, sputum cultures, and analysis. And then last but not least, we have the small cell. This is very fast. Small cell carcinoma is the fastest growing cancer. Very early metastasis. Generally, by the time you find it, you already have metastasis to other areas of the body. These patients present pretty much the same as all the other. They have a cough, hemoptysis, wheezing, pneumonias, pleural effusions. They can have all kinds of electrolyte derangements. They can develop a certain type of endocrine disorder because the oat cell carcinoma can actually secrete antidiuretic hormone and cause SIADH, and you guys should be familiar with this because you had to do a research assignment on it a little while back. Diagnose it in the same way. Sputum culture, bronchoscopy, biopsy, and look at it that way. Okay, so what do? How do we treat cancers in general? We can do surgery. We can remove all the lung. Sometimes we can do what's called a wedge resection, where we just take out a wedge or a lobe. Oftentimes we'll have to do radiation therapy. The radiation destroys the DNA of these fast-growing cells. We can also do chemotherapy. With chemotherapeutic agents, the drugs are similar to radiation in that they work on quickly dividing cells, because cancer cells generally divide very quickly, and so you can target those cells that divide rather quickly versus the normal cells of our body, which don't divide quite as quickly. Other treatments, there are lots and lots of other treatments out there. Things like monoclonal antibodies are becoming very popular, and so on and so forth. Basically, that is lung cancer, obviously in a nutshell, but the basic information that you need to know and how to diagnose it. Okay, guys, I hope you enjoyed this. We're actually getting into the pathophysiology proper now, so it's pretty exciting. All right, guys, take care.